Hey there, dear listeners. Today's guest is my friend and colleague, Dr. Marc Sklar, a.k.a. the Fertility Expert. In addition to his Doctor of Acupuncture and Oriental Medicine, Marc trained at the Harvard Medical School Mind Body Medical Institute. He is the creator of marcsklar.com and reproductivewellness.com, the co-author of Secret to Conception, and a fellow of the American Board of Oriental Reproductive Medicine and medical advisor for Natural Health International. Marc's mission is to bring hope and confidence back into your fertility journey. Through his acclaimed Hope Fertility program, he has helped countless couples uncover the root causes of their fertility challenges, empowering them to heal and improve their reproductive health and ultimately create their dream of having beautiful babies. Unexplained infertility can be an incredibly frustrating situation for couples. Marc will shed light on why this diagnosis is so problematic and the steps couples can take when faced with this challenging situation. We also talk about how it is standard practice to tell women who've experienced a miscarriage to come back after they've experienced 3 miscarriages before anything can be done for them. Marc doesn't believe this is an acceptable standard of care, and you shouldn't either. We discuss when it might be time for women who are trying to conceive to consider seeking professional help and what signs or circumstances should prompt them to consult with a fertility specialist, along with why the right testing is a critical aspect of the trying to conceive journey. Marc explains why testing is so crucial and provides insights into the types of tests that are typically recommended for both women and men. We also delve into the topic of advanced maternal age, which is often misunderstood and can create unnecessary anxiety for women over 35. Marc shares empowering insights and valuable considerations to keep in mind so you can navigate your path to parenthood with confidence and positivity. I hope you enjoy this episode. Hi, Marc. Thank you so much for being on the show.
Thanks for having me. Excited to be here and reconnect. It's been a little bit of time.
It certainly has been. I know. I feel that way too. It's been a while since you've been on before, and I feel like there's a lot more that's come up since we last spoke in the world of fertility. Oh,
That's
yes.
true. There's always stuff coming up, though.
There is. It's so true.
Which is a good thing. I think that's a good thing.
Yes, right. I know. Well, it keeps us on our toes, that's for sure. And, it's interesting, actually. This brings up a point about a recent post I did on Instagram. It was kind of one of those like, don't mistake your experiences with my medical degree. Well, don't equate your medical degree with my lived experience of being in this body, blah, 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 that whole thing. And,
Yeah.
It's one of those. And I asked people to share their more challenging moments, I suppose you could say, with their doctors. And the stories were insane. But
I'm
aside from
sure.
that, yeah, I know you know. But there were a number of women who shared that they had had multiple miscarriages and were told to come back and see the doctor once they'd had 3 miscarriages or more. And I've heard this throughout my years of working in this field, and I know you have too, but I really wanted to discuss this because I just feel like, why is this the standard of care for women? What's happening here? Why are they receiving this? Is it because miscarriage is just so common? Like, what's going on?
Yeah. So I think there's a couple of things there. One is it is so common. Miscarriages, unfortunately, are relatively common. So I do feel like they are downplayed a bit,
Yeah.
especially by a very busy OB-GYN, right? Like they're busy with routine scans and pap smears and visits and whatever else is going on. And they only have a small amount of time with patients anyway. And so then you compound that with someone who already has been trained to believe and understand that miscarriages are super common, no big deal. Just tell them to keep trying again. And so that's just, what they do. They're just like, oh, you'll be pregnant in no time. Don't worry about it. Just keep trying. And so they just downplay it. I think the other piece of that is the, the training that OBs get is really they have very little training when it comes to reproductive health and fertility. There's a lot around, managing gynecological issues, but not really around fertility, which is if they haven't decided to go get more training and become a specialist, they're not going to understand that. So then they also don't understand, well, yes, there's some genetic factors involved, but there could be other things. And they're also not aware, if they're not keeping up on the modern and updated research and information and guidelines, that hey, some of those guidelines have actually changed, right? It's no longer 3 miscarriages and then we do something. That actually has been shortened to 2, which is great. And then I think that the other piece of that really needs to be about advocating for yourself as an individual, and a woman who's going through fertility issues, who's had losses, is being able to truly advocate for yourself, which is by no means easy to do when you're being brushed off. They don't have time for you. Maybe you have, I'm going to call it white coat syndrome, where you just get a little bit nervous and anxious around that individual with the white coat on in the other end of the room or the other side of the desk. And so it's hard to advocate for yourself. I do think if we do advocate for ourselves, with the proper information and knowledge, then we can push those OBs to actually start to do a little bit more testing. I wouldn't be surprised, though, if what they say is, I'm comfortable doing this amount of testing, like, I'll run a few things for you. But in general, this is out of my league. I'm going to send you to the fertility clinic. And so that shouldn't be a surprise. I would say at the very least there, at least they know where their limits are.
Yeah.
And that's good. But those limits are limiting for them and their patients. So I think going in fully educated as an individual to be able to advocate for yourself is really going to really push that envelope much easier for you and open it up and allow those doors to open, and get what you need. But in the end, the reality is you probably need to be with somebody different. You probably need to be under somebody else's care, and you might like that OB. And so they might be good for certain things. It doesn't mean that you don't need to find somebody else who's going to support you in a slightly different way as well, whether it's, an integrative provider, whether it is an IVF or fertility clinic that happens to specialize in recurrent pregnancy loss. There's not many in the country, but there are. And so, it's about being able to really reach out and get those resources for yourself. But really, first and foremost, when you've had a loss, it's about getting tested, in my opinion. And I think those individuals who've had one loss and feel like they need more testing, I want them to listen to themselves. I mean, still, I think the guidelines are 2, and even within my program, we say if you've had 2 or more, this is where we'll do testing. If someone approaches me and says, I know I've only had 1, but this was the circumstance, I really think I need to start doing testing, I'm like, all right, let's do it. Let's just start with some, more common things and make sure that we look at those and rule it out. And then at that point, if you want to do more testing, then we can talk about it and let's see how we, where we go from here. So I think it's also about listening to your gut and not pushing it away, right? Not discounting it. Oh, the doctor said this, so no, this is probably really nothing. I'm going to ignore it. Like, if you really think that something's wrong, let's pay attention to that as well.
Right. Yeah, no, all of this makes so much sense. And I think it's so helpful. And I'm thinking about a friend of mine actually who we studied to be health coaches together, and she has had recurrent miscarriages. So, she's aware of her
Yeah.
health and wellness, and she gets a lot of things. And I feel like even in her situation, she's only now, she has 1 child and has, like I said, had multiple miscarriages throughout the last 5 years, but is really only now thinking about seeking out someone who will do additional testing and try to get to the bottom of what's going on, because she really hasn't gotten that guidance from her doctor. And so you said an OB might get additional training, or they might not. And if they do get additional training, would that mean that they would be able to look for things that would be contributing to recurrent miscarriages?
If they're comfortable doing it. Yeah.
Right.
I
Okay.
mean, there's not a lot of OBs that I know of that are comfortable working within the fertility space and specialty. Their
Okay.
their extent of like feeling comfortable is giving somebody Clomid for a few cycles and saying, go ahead and try, which certainly doesn't necessarily help the point that we're discussing when we're talking about miscarriage.
Yeah.
But I think what they might say is that maybe at least doing some karyotyping, some just to see if there's any issues between the partners. That I think might be at like the tip of the iceberg of where they might be comfortable with doing some things. Maybe someone who's a little bit more comfortable and trained might even say that they're comfortable looking at their thyroid or thyroid antibodies. But that's just like all basic stuff, right? Like that's just
Right.
at the things that they should be getting done anywhere. And so in general, what I find is they just don't have enough time to manage this sort of individual, so they just refer them out.
Right. And so typically
Yeah.
they're going to refer them out to a fertility doctor. So not to someone like you who's more of an integrative specialist. Is that right?
Correct.
Yeah.
Yeah, 100%. They're going to send them to the IVF clinic.
Yeah.
And the misfortune of that is not that there's anything wrong with IVF if someone needs it, is just that most, I'll say 98, almost 99% of fertility clinics I'll say in the country, but it's probably accurate for the world, do not work up a miscarriage in the way that they should, and don't believe that the things that are worked up or are typically looked at that 1 or 2% of practices that do specialize in miscarriage and pregnancy loss. They don't think that those are real things to address.
That they're
um,
warranted.
they don't even think that they're warranted, and even if they do, kind of like in passing, like often what you'll hear from a conventional clinic is they'll say, okay, well, you've had a loss. Now, I don't really think these things are factors, but we're comfortable giving you Lovenox or whatever,
Mhm.
and they're just kind of saying like, yeah, and giving you prednisone. They're like, oh, we'll just hedge our bets. We'll do something for the immune system and we'll do something for blood clotting. And there we go. We don't need to do any testing. We'll just put this into your protocol the next time. But for me, do they even need IVF? Like,
Yeah.
if these things are addressed, they might not even need IVF to get pregnant. So why go that route? And IVF inherently, at its true nature, is not intended to treat pregnancy loss. That's not what it was created for, and not how most practices function. So when someone says, if you walk into an IVF clinic and they say, "Oh, you've had multiple losses, you just need IVF," my answer to them is, well, why? Like, what did you determine in my workup that tells you that I just need IVF? Because in their minds, what they're thinking is, oh, most losses are from a genetic issue. We'll do IVF and do genetic testing on the embryos, and you'll be fine. You'll get pregnant. We'll just transfer a genetically normal embryo. And if that was true, if so, that would be the case if your loss was from a genetic issue, and not only that, but it was from one of the very few genetic issues that are actually tested on an embryo. They don't test everything under the sun. They only test I think it's 4 or 5 big known genetic abnormalities. So, okay, that's fine if it's one of those, but how about if it's something more, more detailed, more, specific to them and not as common? Then how is IVF going to address that? And then what if it's not from genetic issues? The
Exactly.
more common issues that we see, especially in younger individuals, is that it's not genetic. It's either from an immune issue or from some sort of blood clotting factor. And so if they're not looking for that, then how is this going to address it? And those are the things that really education for those patients is needed, because if they go into that conversation with that information, and hopefully after listening to this they do, then from their perspective they can ask those questions, and you'll know if you're in the right place when you speak to them. Now, with that said, I will say there are only I could probably count 4 to 6 reproductive immunologists that specialize in fertility and reproductive health, and we can group in IVF into that, but most of them don't actually do IVF in the country. There's not many of them.
Wow.
Yeah.
That is not a lot at all.
No,
So,
there's not.
so what I keep thinking as I'm hearing you say all of this is that there's got to be some sort of like getting back to basics, because I mean, in my experience, and I don't have anywhere near the fertility experience that you have with my clients, uh, almost across the board, it has been uh, a low progesterone situation, and we know a lot of what causes low progesterone is attached to our diet and lifestyle and things like that. So, is that kind of what you have seen as well?
Yeah, so progesterone, and I'm glad you brought it up because, I start thinking of more extreme situations.
Yes.
And, I often forget about the progesterone in these sorts of conversations. But absolutely, progesterone is a huge reason why we might have a loss. And there's many reasons potentially for having lower progesterone. And so you're correct. If we address those issues, then hopefully we correct those problems. Also staying on top of that once you do get pregnant and advocating for yourself as well for getting some progesterone support during those times, which may or may not be easy depending on the OB that you're working with or whoever it is that you're working with. So there's ways around that. So getting back to the basics, like you mentioned, is really important. I think there's a couple of variables that we need to think about. Certainly thinking about lifestyle and diet and stress are all pieces that could impact this, but
Mhm.
also thinking about it in terms of your overall cycle is that often um, good, healthy progesterone stems from a good, healthy, quality egg. And so it's not always just about thinking about the end of the road here. It's about that whole process and not compartmentalizing your cycles or your hormones or your fertility. It's really stepping back and look at the whole thing. So we still need to work on egg quality and having good, follicular phase, having good ovulation, a strong, healthy ovulation, which will help on the progesterone side. And then all those lifestyle factors for both phases of the cycle as well. And for estrogen and progesterone support is really looking at our diet, our lifestyle, and stress. And the last thing I'd say to that also, in terms of things that hopefully we can control, is all the environmental chemicals that we're exposed to. That's something I'm seeing more and more as well as a huge impact in all of this, and something that really needs to be addressed much more than it is at the moment.
Yeah. I
But
mean,
that's a
how
whole
so
different
though?
conversation. Yeah.
I know. I mean, just briefly, if you can, like, how so are you
Yeah.
seeing that being more of a problem recently versus before? Is something
Well,
shifted?
no, I mean, I don't know that anything's really shifted. What I'd say is I'm doing way more testing on that now than I ever have.
Oh, I
Because I
see.
get to so I get to a place where either someone comes in and they've had a couple of years and they can't get pregnant. And when we do our workup, there's not a ton there. You're just like, well, hormones look okay, not enough to say this is not the reason. And you're doing good with your diet and all these things look okay. Like, yes, we could fine tune it a little bit, but nothing that overtly says to me, like, this should be the reason why. And then so I've been doing a lot more testing on environmental toxins, and I'm just in shock when I see these reports. I
Yeah.
mean, it's amazing to see, especially even with individuals who are conscious, like they know, okay, I shouldn't be drinking out of plastic and cooking in plastic. Okay, I should change my pots and pans, and I've already changed my personal products. And they're aware of all of these things, and then to still see these levels where they're at, to me, that's the frightening thing. That's really the frightening thing.
Yeah, no, I completely agree
Yeah.
with that. I know. Oh man, there's so much. I feel like that is another podcast episode. Anyway, I know. Um, so also, can you just speak briefly to the fact that sperm health also plays a role in miscarriage?
Oh,
And that, I mean, like, I feel like we focus a lot on the egg and not so much on the
yes,
sperm, but there's
yes.
the whole other world out there of sperm health that we never really talk too often about.
Yeah. So my rule of thumb is anytime I see recurrent pregnancy loss, it's absolutely mandatory for the man to be tested, for the partner to be tested. 50% of all fertility issues and 50% of all miscarriages are male factor related. And I just want everyone listening to hear that. If your partner's not with you and you've had losses, just clip this little section and make them listen to it. But absolutely 50% of all losses and all fertility issues are male factor related. And speaking to, by the way, the chemicals we were just talking to, sperm are more sensitive and more volatile, and more easily impacted by these environmental toxins and chemicals than eggs are. Eggs are more protected, so it takes longer to get to them and to be impacted by these chemicals. Sperm are much more sensitive and it happens much faster, which is why we're seeing a huge decline in male factor, a huge increase in male factor, a huge decline in sperm quality over the last 50 years is for this specific point. So my rule of thumb is if you've had recurrent loss, then at the minimum you have to have a semen analysis. But my preference is not just a semen analysis, but a DNA fragmentation test on the sperm, where we're looking closer at the DNA of the cells of the cells of the sperm, and that allows us to really understand how impacted they are by whatever is going on. But also, the higher that number, the higher that percentage it's given to you in a percentage. The higher that percentage, the more likely that is a contributing factor to a pregnancy loss. And the lower that number, the less likely it's a variable in pregnancy loss.
Oh, that's so helpful.
Yeah.
Okay. The other thing that I feel like we really want to touch on or should touch on is this diagnosis of unexplained infertility. And I know that your stance is that this is not a diagnosis. And yet I don't know what the percentage is. Maybe I'm assuming you do, of couples who are just diagnosed with unexplained infertility, and they're kind of just like suggested. I assume IVF is just suggested for them, right?
Right. I mean, IVF is absolutely just suggested because if they don't know what's going on,
Right.
and they haven't bothered to look further, then why? What, they don't have any other means of, supporting them.
Right.
And the research I think that they've done on Unexplained shows that, oh, if we use IVF, then they're going to get pregnant. I can't remember what the percentage is in terms of how frequently they get pregnant with Unexplained, but that's what they're going to lean on. But one of the more interesting things to me about Unexplained that I've recently seen more and more is these couples have a reason. Like, I recently saw someone who had PCOS and was told that she was unexplained. And I was scratching my head. I just didn't understand how those two things go together. Or someone who, speaking of men, the partner had, I think it was low motility and low morphology, and they said that it was unexplained. Like, well, we have reasons right here. Like, maybe if they've done IVF a couple of times and that's been unsuccessful, then they're given that unexplained because it should have worked. And so they're not really leaning on those diagnoses that they've had previously, because those shouldn't be factors once they start IVF at that point. But that's one of the more interesting things that I've recently started to see, is I'm actually seeing that diagnosis be used more, even in situations when someone does have a diagnosis. So then I get questions from couples that we're working with that will say, so it's been a while and I haven't gotten pregnant. Can you tell me why you think, I just got this last week, why you think I can't get pregnant? And I'm like, I'm not going to come up with something, earth shattering here for you. We know that you have X, Y, and Z. And so these are the reasons why that you're not getting pregnant. Now, I know it's frustrating because it still hasn't worked out, but then you're layering two different things, which is, addressing those underlying issues and then the time needed to get pregnant. And sometimes those don't line up. So, it's easy for them to get a little bit frustrated when they're on that path and like, well, I'm doing everything I can. And so now it's just about time, giving yourself time to see that work out. But unexplained is my least favorite diagnosis around, because I just don't feel like they're giving anybody, you're not doing anyone any justice by giving them this diagnosis. Now, I think what's okay to say is, I don't know why you're not getting pregnant. It doesn't mean that there's not a reason for it, but I haven't been able to figure out why. And I would appreciate that a lot more. But what I'll tell everyone who's been given that diagnosis, what I often find is that someone just hasn't looked deep enough to figure out why that's happening. Because when you go to the IVF doctor, you have to remember their job is not necessarily, or their mindset is not necessarily to figure out what's wrong with you. Their mindset is to figure out if you're a good candidate for IVF. Like that's,
Right.
they assume if you're walking into their office that you're there to do IVF. And so let's talk about IVF and what we can do for you. And so they're not looking at it from that vantage point. They're not running labs to look at it from that perspective. And so you need to be mindful of that when you go in for that. And you also have to be mindful of the fact that because of the medical system we live in, where there's all these specialties, they're not going to tread outside of their specific viewpoint. And what that means is if there's another system that's not functioning properly and that's impacting your fertility, they're not going to look into those areas to tell you, oh, this is why, because they have to put on their blinders. They're specialists. This is just where they look. They're staying in their lane.
Right. Yeah, no, I think that's so helpful. I was thinking that as you were saying it, it sounds more like, well, I don't really know why versus it's unexplained.
Yeah.
So right. And this is, I think, totally where you come in. So can we talk a little bit about testing then when you're trying to conceive? Because you were talking about a few different things, but I am so curious. Um, what kind of testing you would do on someone who hasn't been able to get pregnant and you feel like, well, they feel like they should have been able to by whatever certain amount of time.
Yeah. So we started talking about some of those things already, which is, we'll start with the man this time instead of ending with them, is that we have to make sure that's done. I cannot begin to tell all of you how often I still see after someone's been trying for years and years, the partner hasn't been tested.
What?
Yeah, a
Seriously?
partner hasn't, seriously, partner hasn't been tested. They think they're fine. There's no reason. Any excuse that a man gives for not being tested, I have children, I'm healthy, whatever. I'm telling you, that's not a reason not to have a semen analysis done. I just had a couple who's in my program, and I said to her, one of the things we're missing was a semen analysis. And she said, well, he's not willing to do it right now. So we're comfortable moving forward without. Meanwhile, they've been trying for, I don't remember how many years at this point. And I said, well, that's your decision. I don't recommend it, but if that's the way you want to approach it. And so that's why, to that point of like, really, it's still happening. It's still happening. This still happens all the time. So we have to do that first and foremost, or as part of the initial workup. Men need to be tested. And then after the semen analysis, if there's an issue, then we run hormone labs on men as well, and maybe an ultrasound on the testes to see if there's a blockage, a varicocele. And so we want to rule those sorts of things out. And if there's anything in those findings, then we want to address them. For women, even though they've had workups done, I often find that just from a basic foundational level, they're missing a ton of things.
Yeah.
So often, many of them haven't even had their fallopian tubes looked at. So whether it's an HSG or a bubble test, which is more comfortable, looking at the fallopian tubes, and while they're there, why don't they check out the uterine cavity and see if there's anything else, right? Like physically, how does everything look in the reproductive organs? And then from labs, I can't tell you how often all the hormones aren't even done. They might just do AMH often, or just AMH and FSH and nothing more. And even if you said, oh, I've had a whole slew of labs done, it's X amount of pages done. I'm telling you, most of those are STDs and, and viruses is what they checked for, because they have to legally do that as one of the first steps. So you haven't really had a full panel done that's looked at a full thyroid panel, iron levels, vitamin D, all your hormones, FSH, LH, estradiol, AMH, DHEA, testosterone, prolactin, all of these things, one of those things is often ignored or missed. And just basic, cholesterol, glucose, blood sugar. We want all the basics done. So if you haven't had those done, and often when you're going through fertility, you don't because you forego your GP, your regular primary visit, annual visit, and so you don't do a lot of those things because you're, going to all these doctors visits. Like, oh, I don't need to do that right now. So all those basic things have to be done first and foremost. And so that's where we start with everybody. And then from there, we layer in other things. So I love a Dutch test, which is a more detailed hormone panel, where it allows us to see how you're using your hormones. It also gives us a nice, assuming you pick the right test, it also gives you a cortisol rhythm. So you can look at your adrenal function, and it gives you a small organic acid test that helps you look at like B vitamins and detoxification and so forth. So that's a test I love to do. I don't order it in everybody, but if you fall into this unexplained and we just don't know what's going on, or you're a little bit older, been trying for a while, we definitely, group that in. And then one of my favorite things to do is really look at gut health. And I can't begin to tell everybody listening how often I find gut health. I mean, just yesterday, had a conversation with a woman who had a parasite and a virus that we need to address first and foremost. I had another woman who we found a bacteria that was really high, and she was having tons of issues. And these are all real substantial reasons why, overgrowth of yeast. So these are all reasons why we need to address the digestive health. And from everybody sitting there listening, well, my digestive system, why do I need to look at this? Listen, we're at a point where we need to say, remember, if we were just, rewinding 10 minutes and we were talking about all these doctors saying in their specialty and not broadening enough, is that all these systems impact one another. Yeah. The knee bone's connected to the leg bone, right? That whole song. We have to remember that everything touches and communicates with one another. So if one system's not functioning properly, it's going to impact over time another system. And our digestive system is so important for your immune function, for overall health. We could go on and on for hormone regulation, like really like on and on. So
like
anytime I find anything in the digestive system, we have to ovarian function. Yeah,
right?
hormones.
Literally,
we have to start there.
Yeah.
Yeah.
Exactly.
Yeah, we have to start there. So yeah, I mean, we could go on with testing a stool
super
test,
helpful, though.
but it's really important.
Yeah. No, I mean, yeah, exactly. So do you usually do like a GI map or something like that?
Yeah. So I have a couple different companies that we like. GI Map is one of them that we'll utilize. And anything we find in any of those tests, I always tell everybody, if we find something here, this is where we start. And then we work out from there. And that's what we need, that's what we need to do. So in terms of tests, those are some of the places that we go, but there's also more.
That was so helpful, though. And just for anyone who's listening who has been sort of going down the traditional route and maybe hasn't even heard of or realized, because I can't tell you how many women have also come to me over the years, very similarly to you, just saying, well, I've had all these tests and they'll send me 12 pages of tests, but literally none of them are even applicable to what's going on with their fertility. Nothing at all. I'm like, girl, I'm sorry. You just forget all this stuff. This is what we actually need to do. So it is really one of those things that is kind of bizarre to me, actually, that they go through so much. I had this woman reach out the other day on Instagram and she said, she has finally found a functional integrative doctor who is testing her progesterone. She's had like 7 miscarriages. She's been going through fertility treatments for years, and no one ever tested her progesterone. So I just, it's so frustrating. I know it's hard. It's really hard as a practitioner to listen to these stories and hear the anguish, because so much of it could be prevented. I bet you feel the same.
Oh, it's terrible. I 100% feel the same. I mean, the fact that no one, 7 years or 7 losses, all this time, like, and no one's tested her progesterone of all things. I mean, this is just negligence. And so I think what that tells you is it's easy, unfortunately, to stay in that hamster wheel. That was the first thing I thought of when you said that. It's like, she just got caught up in that wheel and it was hard to get off.
Mm-hmm.
We need to pause. We need to take a step back. If you're not getting results with whoever you're working with, then you need to find someone else to support you. You know, we don't, it's not like when we work with couples, we get 100% success rate, right? Like
Right.
sometimes we can get somebody so far and then for whatever reason, it just doesn't work. So, you just need to get help and support. And just because you've been working with someone or just because they're nice and you like them doesn't mean that you need to continue working with them if you're not getting the long-term results and answers that you deserve.
For sure. Absolutely. I know. And I agree what you just said about getting sort of caught up in the system because all of that is mostly covered by insurance. So
Right.
it's so hard to step out of that paradigm
Yeah.
when we've been so conditioned to believe that that's really the root. And and paying for medical care also feels foreign to many of us,
Yeah.
outside of having to pay for copays. So I get that too. And obviously your work is not covered by insurance for the most part. So it is, I feel like it is just a different frame of mind for a lot of people, but it's really important, as you're saying. I mean, I know you're talking about testing right now that some listeners have never even heard of. So it's really good for us to be having that conversation. And this brings me into this idea of advanced maternal age. And I remember the days when those were called geriatric pregnancies. I think we've stopped
Right.
using that terminology now, which is good. But even advanced maternal age is like, ugh. Because I had someone say to me the other day, she was just like, I just turned 35 and my pregnancy a year and a half ago was normal, but now I'm advanced maternal age. I'm like, I'm sorry. I know. I hate that for you.
Yeah.
But there's obviously countless women who over the age of 35 who feel concerned about their fertility because we've sort of been bombarded with this message, right? That our eggs kind of go to shit.
Yeah.
Basically, at
Yeah.
literally they just fall off a cliff at age 35. And getting pregnant over this age is hard or challenging or maybe even impossible. So, I mean, there's a lot of conversation about egg freezing and whatnot, but I think that's another episode, actually. I'll call you. Um, but do you have any insights into I guess not even necessarily improving your fertility as you age, because I feel like there's obviously so much that we can do at any age, but are there specific considerations for someone who is in their mid to late 30s or early 40s that they should keep in mind?
Yeah, I mean, I think the first thing when I hear you say that is I want everyone's mindset to shift differently, which might mean that you have to ignore or, put in earplugs when when you're having some of these conversations and they're using advanced maternal age or they're telling you you're too old and you can't. Um, I just let them talk and kind of just wah, 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 wah. And I just, and then I just need to not hold on to those statements that they say. So I really, from the first thing I would say is just know that women for centuries have been conceiving in their 40s and can do it. And that is no different for you. It doesn't mean you ignore the things that you know that need to be addressed, but I want you to all know that it's absolutely possible to conceive in your late 30s into your 40s, that you're not too old, which will take some, retraining of your mind, and constant affirmations and journaling to kind of get out and, you know, get those words and thoughts and phrases out of your mind. But I think it's really valuable because I think it's so impactful what they say. They don't realize the sort of damage that they're doing mentally and emotionally to all of us when they say those words. And so I think from initially, the first thing I would say is just work on mindset. The second thing is the only thing you cannot change about everything you're trying to manage in your health and your fertility is your age. We can't turn back the clock, at least not, in terms of age wise. But what you can do is turn back the clock on your cellular age, and that's where your focus should be. So working on addressing that and not worrying about how long you've lived on this earth. And then, from there, if you've been addressing all the root issues, then you're going to do what you need to do, right? The only bigger picture that I find that happens, or bigger issue that I find that happens when we are dealing with age, and getting older, is we end up having to make certain decisions, a little bit faster or a little bit sooner. And so that time frame piece is really the biggest variable that we need to address. And that can be tricky because you're being pushed in one way from somebody, maybe somebody else is telling you you have time, and balancing all those things out. So I think the first thing is that you as a couple need to come up with where you're comfortable, like what you're comfortable with in terms of time, how much time you're willing to give, how much time you're willing to put into anything, that you're doing. Draw a line in the sand, not ask yourself the question every cycle if you're not pregnant, what do we do now? So, because that's stressful and challenging and difficult. And so I would say if you're working with somebody and they say, we need X amount of time, then, and you're comfortable with that, then give yourself that time and draw the line in the sand, put a reminder on your calendar on X date, say like, we can revisit this conversation now, right? And it doesn't mean that you can't move the line later. It's in the sand. We can rub it out and draw a new one later down the road, right? But it means that you're giving yourself a point in the future that you're going to re-engage as a couple to have this conversation and reassess where you're at and decide how you move forward, so that you're not having this on a weekly or monthly basis, because that's not going to be productive. And it also allows you to give whatever it is that you're doing time to be effective, time to work. These things don't work in a day or a week or often even in a cycle. So you need to get, if you're committing to that, you need to give it the time and space to achieve some goals, and then reassess to decide, do you move forward? Is there maybe a time that you say to yourself, well, we've come to this point and I think it's time that we look at IVF? Well, absolutely, that might happen. And you might need, different intervention to get your result. And we will have those conversations with somebody as well if we feel like, hey, you've done everything and now we've given yourself time, and if you feel like you need to go that route, that's fine. But it's about giving yourself the space to achieve those results before you're pushed prematurely into a path or a treatment that you weren't comfortable with in the beginning. I think you referenced an example of a woman who was told she had unexplained and she'd only been trying for a short period of time and she was relatively young, and they were said, oh yeah, your answer is IVF. Like, that's not really an answer. And so those individuals maybe have more time, if they're younger in their early 30s, than someone who's in their late 30s, early 40s, but you all still have the space or can create the space to get results, and then revisit that path of IVF or that choice of IVF if it's necessary.
I think that that's such excellent advice. And I was thinking about any kind of words of wisdom or encouragement for individuals or couples who may be feeling discouraged, or even overwhelmed on this journey. Do you have anything to share with anyone who's listening who might be feeling that?
Yeah, look, I think we all need to stand up for ourselves and advocate for ourselves. But also, you need to seek out a different perspective. Those perspectives are going to give you hope, going to give you a new light, and a new path that you could achieve things with. And I'm telling you, I've seen women get pregnant and couples get pregnant at all ages with all sorts of issues, and all sorts of complications. And I know it's possible. It's giving yourself the space and the time to achieve those goals and believing that you can. I mean, I really, really think that all of this starts with our mindset, that we need to understand inherently that you were created to have children, you can have children, you will have children. You just often need a little bit more support, and you need a little bit more belief and hope in yourself that you can achieve those things. And I'm here to tell you, I've witnessed it. It can happen. I believe that it can, and I have hope that you can achieve these things. So if you don't believe it right now, you could take some of my belief and hope in you, and piggyback on that until you're on board with your 2 feet on the ground, saying that, yes, I believe in myself.
Oh, thank you. That was so lovely. And I really appreciate all that you shared, because like I said before, I feel like there are so many people who are just stuck in a system with, one perspective. And as you mentioned, seeking outside guidance and different perspectives can be, I mean, pretty much life changing and can help you become a parent faster. So thanks, Marc. This was really good. Can you share with everyone where they can find you? I know you have a ton of resources.
Yeah, my favorite resource is my YouTube channel, Fertility TV. I've got hundreds and hundreds of videos that you can check out. They're a great resource for everybody and a good place to start on whatever topic you're looking for. But you can also find me on Facebook, Instagram, or at my website, marcsklar.com.
Thank you so much. You're the best. Thanks. That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest Period Party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at nicolejardim.com/quiz.